Okay, good afternoon again, everyone. I saw Eric, so we will go ahead and get started. It's been a while, so welcome back. This is our Calhoun County Joint Information Center, our COVID-19 community update, and we will jump right in. Reminder, the PIOs, public information officers, are on here. If anybody has any questions, you can use the chat function. I'm Jessica Vanderkolk, the PIO from the city of Battle Creek. This is our unified command team, Kelly Scott. We have Ted Deering on today for Rebecca Fleury and Eric Pessel. And our additional speaker today, Dr. William Nettleton, is back with us, our county medical director. Again, we're continuing to work through our response to COVID-19. Our agenda for today, lots of Eric and Dr. Nettleton. So let's jump right in with Eric and our current situation.
Thank you, Jessica, and good afternoon, everybody. As we typically do with this slide deck, we just kind of first go as an overview of where we have been since the actual beginning of the pandemic, and you can see that we've now confirmed well over 30,000 cases, and we've also confirmed our cumulative 573 deaths from COVID. And then I would just point out in the graphic on the right hand side, you can see that there was a very large spike last December leading into December 2021, January 2022. You can see a little bit to the left of that, a smaller spike that was started in November of 21. And, those are things that we are continuing to watch. You can see where it dropped off in March and then started to pick up again as we went through the summer. As you look to the right of the graph, we're going to continue to expectations here is that as it turns cold and the weather changes and we move indoors, that we will probably see an increase in cases in the late fall, early winter period. So we would, expect hopefully not quite as big a surge, but certainly a graph that looks similar where we have the ebbs and flows will continue. Next slide. So this is a slide that's basically talking about our hospitalizations. And since February 1st of 2021, we have had 1,539 new hospital admissions in Calhoun County. Recently, as late as late last week, we were seeing an increase in Calhoun County in hospitalizations, and that was something that we really hadn't seen for quite some time. Even though we've seen a surge in case counts over the last several weeks or months, our hospitalizations were relatively steady in Calhoun County. And then late last week, we saw a little bit of a jump. We paid attention to that. We didn't want to jump to any conclusions because we wanted to see what would happen over time. And fortunately, we saw a significant reduction over the weekend. And then the early part of this week, we're not seeing the same rate of hospital admissions. So we think that was really a blip last week right now, but it's something we're going to keep an eye on as we move forward, because, overall with COVID right now, the general theme is that there's a lot of disease out in our community right now, but it's not as severe. We don't see the hospitalizations and the threat and the ICU units that we were seeing last year, where you can see that big spike in hospitalizations in December of last year. We're not seeing that, and we think that will continue. Next slide. So our community transmission level, as I just indicated, we are seeing a lot of disease in our community, and we are considered in the high transmission level right now in Calhoun County. This is updated on our website every Friday morning. The CDC updates this on Thursday night. So we take a look at it. We update it on Friday morning for those folks that are interested and may do things differently based on what the transmission level is at the time. And you can see the reason we're high. One, we're up over 200 cases per 100,000 over 7 days. We're also new hospital admissions. Like I said, last week we saw an increase. We're up to 12.3 for a 7-day total. And that's one of the reasons that we went to high. We have been basically since the latter part of the summer, and I guess this is the last day of summer. So basically since July, we've been bouncing back and forth between really medium and high. And this is a weekly review on transmission level. Next slide. So we did this fall, and then recently the state came out with some back to school guidance, but earlier this fall, before school started, we were able to work with our school districts again, our superintendents, our private schools, to give them some guidance on COVID and what to expect for the coming school year. We're still seeing, quite a few cases in our schools, and it's disruptive from the standpoint of students aren't in class. Some staff have to miss time just because they're becoming infected, and they're not sick enough to be in the hospital, but they are sick enough to maybe not attend school. We still want folks to, when they do test positive, to stay home for 5 days. And then when they return, as long as their symptoms are improving or have resolved, and they don't have a fever for 24 hours, when they do return, we really want them to wear a mask for another 5 days for a total of 10 as a protective measure now that they would be back in school or back in their general workforce. But those guidelines are on our website, they're on the state's website, and they're fairly, I'll say, streamlined from what they've been in the past. I know our schools are doing a great job of handling this so far this early school year. We did see quite a few cases over the first couple of weeks. I was told today by our epidemiologist that we're starting to see our school case counts maybe go down a little bit, which is great news as well. Next slide. Just a shout out that we got upcoming booster clinics now that we have the bivalent booster. And I know that Dr. Nettleton's going to talk about that here in a second, but just wanted to let everybody know we do have a mass clinic scheduled for tomorrow at the Battle Creek YMCA from 8 to 3. It's all walk-in only. On Friday, we are appointment only in Albion at the Albion Health Department. The phone number is there. Eligibility, anybody that's 18 or older can have the bivalent Moderna vaccine. Anybody 12 and older is eligible for the bivalent Pfizer vaccine. And Dr. Nettleton, like I said, is going to talk about that a little more. Next slide. Okay, I think I'm going to turn it over to Doc.
Thanks, Eric. So just a little more background about what is a COVID-19 bivalent booster. So that word bivalent. And so what this vaccine includes is a component of the ancestral or original COVID-19 strain from 2020, and now also a component of the most recent Omicron variant known as BA4 or BA5. So both are included, and that is what's known as a bivalent COVID-19 vaccine. It's the most common variant that's circulating right now is that BA4, BA5, very infectious. The idea is to promote better protection in the population going into the fall or the winter. So those who are 12 years and older who have received their primary series can receive the Pfizer vaccine. Those who are 18 years or older who have completed their primary series of COVID-19 vaccine may receive the Moderna vaccine. So just some differences there in age group between the vaccines, but it is again a booster. So you must have received your primary vaccine series first to receive this booster at least 2 months after your last COVID-19 vaccine. So as Eric pointed out, we're having large vaccine clinics this week, and you can find other opportunities to be vaccinated in Calhoun County at vaccines.gov. Overall, it is thought that side effects that a person may experience is very similar to other COVID-19 vaccines. And so sore arm, for example, maybe feeling down for a day or two. Okay, next slide, please. This slide is just meant, the next two slides are just meant to illustrate the following. So if you look at the Moderna and the Pfizer vaccines, for those who are getting 12 or 18 years or older, now the bivalent vaccine has replaced the monovalent or ancestral strain vaccine. So you can no longer receive the monovalent or original version as a booster. It's now only authorized to receive the bivalent once you've completed your primary series. Next slide. The purpose of this slide is to illustrate that the primary series for those who are moderately or severely immunocompromised, in other words, have a decreased immune system, includes 3 doses of your primary vaccine series before you are eligible to receive your bivalent booster dose. Next slide, please. Another pathogen or virus we all need to be aware of going into the fall is, of course, influenza. Now, oftentimes I often hear it's just the flu, and that really is a misnomer. I think a lot of people think about flu as a stomach upset or a bug flu, and that they are really different viruses than what folks normally just say day to day. They are different. And influenza can be a serious respiratory infection for anybody, but for particularly those who are very young, those who have underlying medical conditions, those who are pregnant, and those who are over the age of 65. All of those individuals are at higher risk for complications such as hospitalization from influenza. So we look to the Southern Hemisphere to give a ballpark of what our flu season could be going into the fall or the winter. In the last several years, influenza has been pretty low in the United States and in Michigan. And this has been thought that it's secondary to all the COVID-19 mitigation strategies people were doing, such as masking and social distancing. This year down in Australia, which again, we look to see what it could be like in the United States, they are seeing much more flu or influenza circulating. So the health department is administering influenza vaccines, as are other community healthcare partners. And you can get your flu vaccine now in Calhoun County. September, October are good times to initiate and to go ahead and continue to vaccinate throughout the fall, winter, and even into early spring. Next slide. And just one quick note before Eric chimes in, it is the recommendation that those who are 6 months and older to receive the annual influenza vaccine. So those are 6 months and older. Back to you, Eric.
Thanks, Doc. And just following up with where Dr. Nettleton left off, here's an update on our flu shots and when we'll be able, or when we're planning for either special flu shot locations or just our normal office walk-in hours or by appointment. I would also like to point out that we have purchased a mobile health unit. It's called the Calhoun Wellness Wagon. You see a picture of it there. We're working on a wrap that's going to go around that, and that will be a way for us to get out into our community, get into some of those underserved areas, more rural areas that have a hard time getting to us or getting to a provider to be able to do some of these vaccine clinics. So look for that coming soon. We'll probably be out this fall. I just don't have a date certain yet, but it will be coming soon. You'll see the wellness wagon running around town and maybe out in the country. And we're going to hopefully be able to pick up folks all over that maybe have a hard time getting in to get that vaccine or some of the other services that we provide. And with that, I think, Jessica, that is our update.
Almost. We've got one more little Q&A session for Dr. Nettleton.
Back for Doc. Okay.
Well, sure. I guess I'll go ahead and just read these. Do I have to get the primary COVID-19 vaccine in order to get the new booster dose? Yes. As I mentioned, you must complete your primary series first. Can children get the new booster? If not, when a pediatric version be available? These vaccines are authorized for those who are 12 years or older for the Pfizer and those who are 18 years or older for the Moderna. I do not know when a pediatric bivalent booster will be available or authorized. What about getting a COVID booster and flu shot at the same time? Yes, this is safe. We have a wide body of evidence to support from our prior flu seasons and our prior COVID vaccinations that it's both still safe and effective to get both at the same time. In fact, last flu season, I got my COVID booster in one arm and my flu shot in the other. Should expired COVID-19 test kits be tossed? Are they safe to use? I think the greatest risk for folks, if they have an expired COVID-19 test, that it's not been validated to still give accurate results. And with COVID-19 tests that are antigen or home tests, the greatest risk for those tests is a false negative. And so that's what I'd be looking out for with respect to expiration dates, that you'd have inaccuracy and false confidence when that test comes back negative, when it could actually indeed be positive.
Great. Thank you so much, Eric and Dr. Nettleton, both. So at this point in the session, I know I've seen a couple of representatives and officials on. Any level of official or representative of an official who might have an update, if you want to raise your hand and we can call on you to give any information you have for the group today. All right, not seeing any hands up, so I'll put one more call out there. If any officials or representatives on the line today have an update they want to share, if you want to raise your hand up or just unmute and go for it. All right, I don't see anybody today. So again, our list of the best information sources, those have not changed: city, county, state, and the CDC. And then, as always, Lucy, Victor, and I are your public information officers. And if anybody has any questions related to this presentation and other information we're sharing and sending out, please get in touch with us. I see Karen in the chat. Thank you so much. And with that, we will end today's update. Thanks so much to Eric and Dr. Nettleton and to everyone for attending. Take care.